All of you take your pencils, papers, and everything. Yes. This is a medical letter, and below is nursing letter. Both are here. This is nursing letter. Okay. Now let us quickly go through the sentences. How to write sentences. How to write sentences. Now let us see what will go into the address. So first address. Address. Okay. So we have different things. What are the different things that go into the letter? So here, according to this, if you see very clearly in the address, medical letter. So first one, the address. The address for medicine students. First one, the address for medicine students. Now, what should come in the address? What should come in the address? So first thing is the name. Next one is the profession. Next one is the street, the facility. Next one is the street, the name, the street, the city, okay, the city or town. Then the country. So anything, 5 things may come there. So how are you going to write all these things? Okay, these are the things. Now let us see what are there. Okay. Now the name, you're writing the name. So you're writing to Dr. Giovanni Decompensated. Dr. Giovanni Decompensated. So this is the name. Dr. Giovanni Decompensated. Fine. So we got it done. So first we got with the name of the doctor. Then next, is the patient's primary care physician. Okay, the patient's primary care physician. Okay, so here we'll take primary care physician. So that is the profession. We got the profession now. What are you supposed to do here? This is a capital letter, C capital letter, physician, P capital letter. So primary care physician. Next, the facility. Facility is proudest family practice. Proudest family practice. That is the next one. The next, the street. So 231 Brightfield Avenue. That is the street. We got the street now. Next, the city is proudest. Yeah, the city. Country is not given, so excluded. That's it. This is the medicine address. The address for the medicine. Okay. Now, this is how we are going to write the address. Okay. So this is one part of the story. One part of the story. Right. Then the next part of the story is the address for nursing. Address for the nursing. Yeah. Now for the address, we'll take here a writing to Mario Decompensated. Mario Decompensated. Mario Decompensated. Now, Mario Decompensated. Maria is a lady. We don't know her, title, Miss or Mrs. So better write Miss. That's all. Miss. That's it. For doctor, we are writing doctor, but for nurse, you have to write something. No? The next one. Proudest mental health home. Proudest mental health home. So proudest mental health home. Next one is 231 Brightfield Avenue. Yeah, all capitals, first letter all capitals. Then proudest. So this is nursing. Okay. So this is how we are going to write the addresses. So the address is done with next the date. Date. This is a discharge letter. So discharge date. Admission date is here. Discharge date is here. This is the discharge date. Okay. So 18th March. 18th March. So let us see. This is the discharge date. 18th March. Okay. Right. Admission 1st March. Discharge 18th March. So, right. Right. This is the first address. That's very clear. Discharge date is 18 March. Okay. Right. The case is decompensated schizophrenia. Case is decompensated schizophrenia. Patient self-admitted with decompensated schizophrenia. Okay. Right. Now, okay. So this is how you are going to take the address. Okay. So let us see the medical sample. So this is how we are getting the address. And let us see the nursing sample. We are getting the address. That's it. Next date, 19th March 2018. How come 19th March 2018? How can you write a letter after discharge? So there is something wrong here. Okay, discharge date is very clearly given 18th March. So the response, we have some problem here. So forget that, it's 19th March. No. So here it is very clearly mentioned in the case notes. 18th March is the discharge date. One day before you can write, but not one day after. Okay. Or did they come again after discharge with the letter? Otherwise, it's a mistake. Yeah. Discharge back to apartment with follow-up at Proudest Mental Health Clinic. Okay. Fine. So let us take the same date, what is given in the case notes, because there is no clue anywhere else. There is no clue anywhere else. So let us take the discharge date as 18 March 2018, and we are going to write the letter on the same day. So 18 March 2018. So leave one line after everything. So this is the date, the address over, and the date. Right. The next dates follow. Next, what will be there? So next one will be the salutation. Salutation, no need to go anywhere. From here only you will take the salutation. This only, first line, you will take the salutation here. So, Dr. Giovanni Decopsio. Before that, you can write dear Doctor, second name. First name is not needed. Dear Dr. Decopsio. Good evening, Nasra. Dear Dr. Decopsio. And just put comma. Here you put comma. Next, here, for nurses, Mrs. Maria Decopsio. Miss Maria Decopsio. So that only you take. But here, we'll remove the first name and say, Dear Miss Decopsio, and then put a comma. Okay. Dear Miss Decopsio, and you'll put a comma. Then first address is over, then date finished, then salutation over. Next one you have the subject line. The subject line. What is the subject line? You have to say regarding, colon, immediately. After that space. Many people what they do, space and then colon. That is wrong. This is not right. Punctuation mistake. So colon should be immediate, then space. So remember that. Regarding, yes. Now, regarding, let us see here. Miss Bethany Taylor. So regarding Miss Bethany Taylor, there may be many mistakes sometimes in even the books also. You have to be very careful. This is Miss Bethany Taylor. So you are going to write here, Miss Bethany Taylor. So regarding Miss Bethany Taylor, comma. After, Miss Bethany Taylor. See, for example, what is given in the sample letter. Let us check once. Okay, no miss here. See, there may be some problems like this. So don't think that this letter is perfect. This letter is not perfect. Okay, this letter is not perfect. So don't think everything is perfect in the sample letter. Sometimes they'll give the letters and these mistakes or discrepancies may be there. So I want you, you are my students. You want to be perfect. Okay, so I'm giving you the rules where you will not miss anything. So regarding Miss Bethany Taylor, the next, so let us take in the medicine letter, nurse letter. Here also Miss is missing. Why is Miss missing? Okay, here they wrote Miss, but why here it is not there? That's the point. So there are chances that there may not be perfect. It's a sample letter. It's a sample letter. So no need to worry about that. Okay. So Miss Bethany Taylor, and we have date of birth. Where is date of birth? Check date of birth numbers. Date of birth. Where is date of birth? Is it given? So date of birth. Okay. She is 35 years old. So that is one clue. And what about the date of birth? Admission date is here. Okay. Admission date is here. Have to be very careful. Many places there are options. Date of birth. Date of birth. Date of birth is not given here. Just check very carefully once again how things may miss. Okay. So starting from here, this is admission date. This is discharge date. Last used for coin. This is different. Admission date. Okay. This is one date. This is another date. So nowhere else date. Okay, so there is no date. Now let us see in the official letter. So here it is aged 35. Okay, this is fine. Date of birth is not given. That's fine. Now let us take here. Bethany Taylor, date of birth 20 April 2. How can it be 20 April 2018? This is a mistake. This is a mistake. Okay. So let us just check the official book. So Bethany Taylor. So don't think everything is perfect. That's what I'm telling you now. Bethany Taylor. Okay. Bethany Taylor. Yeah. So yeah, here it is, date of birth. So here it's a problem. 2018 date of birth. And how can it be? Blindly it was given here. You're writing 19th March, 18th March, and here it is 20th April date of birth. How can it be post? So there is some sort of confusion here. So, right, you can check it out. So be careful with such things. Okay. Fine. Next. So date of birth is not given. One final clue. Let us check once again if we missed anywhere. So date of birth is not given. So date of birth is given late. Even after the letter is written, date of birth, how can it be possible? So admitted herself on 1st March 2018. Okay, that's very clear here. Then this is 19/3/2018, and this is April 20, 2018. So the person is not even born. Not even born. According to this date of birth, okay, she will be born after 1 month, 1 day. So this is wrong. So be careful. Okay. So date of birth is not given here. So just to take the age, 35 years old patient. 35-year-old patient, 35. So just you have to write age, that's all. Aged 35. That's it. So nurse's letter also, it will be the same. So that's very clear. Next, we'll be writing the body of the letter. Body of the letter. Okay. Body of the letter we'll see later. Okay. Body of the letter we'll see later. Yeah. Then next, after the body of the letter, okay, here we have closing remarks. Yours, yours. Some people will put apostrophe here. That is wrong. That is wrong. Yours. And here the name is already given, Dr. Giovanni Dicoxio. So yours sincerely, comma, sincerely, comma, right. Then next, here also the same thing will come. Nursing letter, it will be the same thing. Yours sincerely, right. Then next, you have the address, your address. What is your address? Let us see here. Your address is the case writing task. So, using the information given in the case notes, write a discharge letter to the patient's primary care physician, Dr. Giovanni Dicoxio. So, you are writing as a doctor for medical letter, you're writing as a doctor. So, you see here, you are working as a doctor or nurse. Okay, you're writing as a doctor or nurse. Okay, doctor, right. So, this is doctor. Right. And here it is nurse. So you can say register nurse. Fine. So here we have written doctor and here we have written nurse. Here you have to leave 2 lines. After you are sincerely, leave 2 lines for signature and name. Signature and name. And here also 2 lines. Signature and name. Remember that. So then next, what else? The remaining address. St. Mary's Hospital. From here. Okay. Right. St. Mary's Hospital, 32 Frederick Street, Southwest. St. Mary's Hospital, 32 Frederick Street, Southwest. The same address will go here also. Yeah, that's done. So only we are left with body of the letter. We are left with only the body of the letter. Now let me ask you a question. Is the information okay? Concept check questions. Concept check questions. What's it? So clarity achieved. You have to say yes or no. Give your answer yes or no. You can submit in the chat box yes or no. If you understood everything what I have told you till now. The other than, so this is the address, date, salutation, then subject line, body of the letter. We are going to do afterwards now. Once you say yes, we'll move forward. Then closing remarks, and this is the sender's address. The next nurse, it is the same thing. Everywhere you leave one line, but after you are sincerely, you leave two lines. Noor, Maranang, and Asha. You have given the response. What about the others? What about the others? iPhone. Can you please give me your name? First and second names, please. Yeah. So now we are moving forward to the body of the letter. Medicine. So here you will get first one will be the introduction. The introduction. First one will be the introduction. So 5 paragraphs altogether. This is the body paragraph 1. Body paragraph, okay, 1. The main body paragraph. Total 5 paragraphs are there. The main body paragraph 1. Fine. Next one is the main body paragraph 2. And then the main body paragraph 3. So, and here it is the conclusion. Yeah. That is the conclusion. So, yes, Dr. Noor, what is that? Can you mention if you have any doubts? So this, the nurses also, the same thing. Yeah. So that's very clear. So, introduction. Introduction. How are we going to write the introduction now? Now, in the introduction, you will take the patient's name. First, you start with the patient's name. Okay, it's not final. It's not final. Okay, this is rough. I'm just giving the bullet points. Miss Bethany Taylor. Next, right? She what happened? Self-admitted. So patient is already there. We took the name. So self-admitted with decompensated schizophrenia. Okay. So self-admitted. This is the point. Copy text. So self-admitted. This is one point. Next one is decompensated schizophrenia. So that is the next point. So we get all these points like this. We get all these points. What are the points that will go into this? Self-admitted, decompensated, schizophrenia. What are the points which are going here? Take it. First, second. Names, please. iPhone. I cannot call you iPhone. No, I don't know who my student is. So please give your name. Second time I'm asking. Okay. So decompensated schizophrenia. Next one is, yeah, what else? So this is a worsened condition, decompensated schizophrenia. Already she has schizophrenia. It's decompensated now. So emergency. Right. At the time of admission, it was emergency. Now it is not anymore an emergency. Now what is happening? Discharge. So it is a discharge letter. Discharged. So this word also should come, discharge. Okay. Just to type in the tag here. And just to type in the tag, I will change it. Yeah. Thank you for responding. Yeah. So this is the point. Miss Bethany Taylor, self-admitted. Yeah, Deepak Bhatti. Fine. The name should be capitalized. It should be capital. Yes. So, discharge letter. And now, so this is the name of the patient. And this is the status, we can say. At the time, okay, this is the case. This is the case. And this is the type of letter. Type of letter. And this is the condition while admission. Condition while admission. Okay. Right. Admitted. The next one is purpose. Why are you writing this letter? Why are you writing this letter? So, now let us see why you are writing the letter. So, follow-up is required. Follow-up is required. Follow-up. The purpose is follow-up. Yeah. Follow-up. Where follow-up? Proudest Mental Health Clinic. Follow-up at Proudest. So, you have to write here. At your facility. Follow up at your facility. And discharge. Discharge where? Where is she going? Where is she going now? Yeah. So next of kin Henry Taylor and Barbara Taylor. So she will be going to live with her parents. Okay. So it's not a transfer letter. Discharge back to apartment. She's going back to apartment. Okay. Discharge back to apartment. Copy text. Discharge back to the apartment or her apartment. See how I'm picking up the answers, information from the case notes. Discharge back to the apartment. Right. Then, so this is how you are going to write. Now, you can write the introduction. Miss Taylor, second name is enough because just before only we wrote already. Miss Bethany Taylor, already we have written, no need to write full. Miss Taylor, comma, who was self-admitted, okay, with decompensated schizophrenia, comma, requires Miss Taylor, who was self-admitted with decompensated schizophrenia, requires follow-up at your facility after, okay, following the discharge back to the apartment. Back to the apartment today. So, Miss Taylor, who was self-admitted with decompensated schizophrenia, requires follow-up at your facility following the discharge back to the apartment today. Okay, now let us see from where this sentence has come. Okay, Miss Taylor was self-admitted, okay, with decompensated schizophrenia. This is first sentence. Second sentence is Miss Taylor requires follow-up at your facility. Okay. Miss Taylor is being discharged back to the apartment today. So these are the three sentences. These are the three sentences how you frame the introduction. This is the way how you have to write. Welcome, Pranita. So this is how you have to write. Three sentences. Then if you want to write separate sentences, you can say like this. Follow-up is required. Follow-up at your facility is required. So this is the way how you can change it to passive voice. Okay. You can write in number of different ways. Okay. So good evening. Yeah. So this is how you will write the introduction. There are many ways. Right. There are many ways to write. So you can also write in many different ways. Now, when was she admitted? On 1st March 2018. She was admitted on 1st March 2018. So let us take this one. Okay. Now, why was she in this condition? Because maybe of this reason. Maybe because of this reason. Okay. Maybe because of this reason. Right. So you can write many different sentences. Miss Taylor. Okay. Miss Taylor was admitted to the hospital. Miss Taylor was admitted to the hospital on 1 March 2018. On 1 March 2018. Okay. Miss Taylor was admitted to the hospital on 1 March 2018. So this also you can write with the complaint um, with decompensated schizophrenia. Decompensated schizophrenia. Decompensated schizophrenia. Okay. So this is the way how you can write. And this is probably due to non-compliant with medications. Probably due to medication non-compliance. Medication non-compliance. Okay. Ensure medical compliance, medication compliance. Right. So you can write that one also. So this is the way how you are going to write differently. Then you can say she will be discharged. She will be discharged. She will be discharged back. She will be discharged back to the apartment today. This is the second sentence. This is the second. This is different type of introduction. She will be discharged back to the apartment today. She requires follow-up at your facility. So this is the way how you can write another type of introduction. Another type of introduction. So now here too many times a she is coming. You can avoid that one. Okay, how can we avoid discharge has been scheduled for today. Okay. Discharge has been scheduled for today. She requires follow-up at your facility. Okay, follow up at your facility is required. Follow up at your facility is required. Follow up at your facility is required. See, the same things I am showing you. This is active voice, this is passive voice, This is also passive voice, but she is there. This is active voice. Passive voice. This is passive voice sentence. Okay. But this is she. The word she is there. So personal pronoun. So avoid this one. It's also right, but quality is low. Right? And this is active voice. Active voice. And also personal pronoun. Personal pronoun also is there. Avoid personal pronouns wherever it is. Follow up at your facility is required. Is anticipated. Okay. So this is the way how you can write. Same sentence. These two sentences are same. So this I am putting in bracket. Okay. Fine. Let it be like that. So this is passive voice. Passive voice without personal pronoun. Without personal pronoun. Without personal pronoun. This is also passive voice. Without personal pronoun. So now you see, first one is no problem. It's already passive voice. Okay. Right. So he, she, whatever it is, try to avoid as far as possible. Right. Now you can write any different style, whichever you want. So was the explanation clear? If it is a yes, say yes. If it is not clear, say no. You can write in one sentence. You can write in two sentences. You can write in three sentences. But which is the best? This is B grade sentence. This is B plus quality. This is A grade sentence. Now you think about how to write whatever it is, you can write. What about the others? Just hit the button yes or no. You can also say many different sentences. You can also say many other sentences are there. She is now ready for discharge. This also you can use. She is now ready for discharge. The other type of sentences. I'm going to show you some more types of sentences. Miss Taylor um, admitted herself. Miss Taylor admitted herself on 1 March 2018 with decompensated schizophrenia. Okay. Miss Taylor admitted herself on 1 March 2018 with decompensated schizophrenia. Okay. Follow up at your facility is required. Follow-up at your facility is anticipated, is expected, is required. So that is why you're writing. You're expecting follow-up at their facility. So that's why you're writing like this. Yeah, all of you. So many different styles I have given you now. So these are the things, components which will go into the, so name, condition, case, type of letter, purpose. Okay. So 3 different sentences, right? Next, how to avoid she using passive voice. This is passive voice with personal pronoun. This is passive voice without personal pronoun. There are many students who asked me. So that's why I'm explaining. Okay. So all these are correct. All these are correct. This is a B grade sentence. This is a B plus sentence. The quality is A grade, but the 3 different sentences will drop down you again to B grade. And this is A grade sentence. A grade sentence. So one sentence you have written everything. This is A grade sentence. All right. The same thing everywhere. This is right. Next one. So the nurses, you have the same information. Information is the same. Information is the same, but the presentation will be different. Now let us see. Nursing letter. So it is changed. Long-term care home. She is going to the long-term care home here. She is going to the long-term care home. Actually, this is a little bit confused letter. Okay, discharge back to apartment he is telling, and here again, see, because they wanted to mix up both the letters, nursing and doctors, so that's why they have given. But here it is very clearly given that write a letter to the receiving nurse at a long-term care home where the patient will go for a discharge. This is little misleading. Okay, so you are going to write, so she is going to the mental health home now here, remember. So long-term care, she requires long-term care. Try to understand the complication here. So she is not going to the apartment according to this letter. Okay, so you have to be very careful. She is going to the long-term care home. That is Proudest mental health home. So this is a new thing coming. She's not going back to the apartment here. That's okay. So don't think one thing is there. This is a little confusing because 2 professions are given, nurse and doctors. So that's why they messed up here. Okay. Now this is the point here. She is not going back home. She is going to discharge to the long-term care home. Discharge to the long-term care home. There's the point here. So now the letter will be the same again. Miss Bethany Taylor. So first let us write A grade sentence. If we don't follow them, let us go for B plus. Then B grade. So Miss Bethany Taylor, comma, right. So she was admitted. Okay. So who was self-admitted or somebody admitted, it's not a big issue here. They don't need to know about that one. Okay. They don't need to go whether she's self-admitted or not. They don't need. Okay. She's self-admitted or admitted by somebody else doesn't make much difference. So Miss Bethany Taylor, who was admitted to the hospital with who was admitted. This is more important. Miss Bethany Taylor, comma, who was admitted to the hospital with decompensated schizophrenia. Decompensated schizophrenia. Now, comma. Now here you have to be very careful again. The information regarding decompensated schizophrenia is not given in one place, actually. So the diagnosis is schizophrenia. She was diagnosed with schizophrenia long back. Okay, but that condition worsened now. So that's why admitted with the decompensated schizophrenia. So you don't just write a diagnosed with schizophrenia. That is also correct. For a diagnosed with schizophrenia, why should she go to the hospital and get admitted there? Diagnosed is right, no problem. She was diagnosed with schizophrenia, that is true, but not the present condition. So condition, self-admitted, now self-admitted. So schizophrenia was diagnosed schizophrenia long back. So this is there, diagnosed. Diagnosis is schizophrenia. Many people write who was diagnosed with schizophrenia, but she was not admitted to the hospital with schizophrenia. Yeah, schizophrenia is there. She was admitted with schizophrenia, but not normal schizophrenia. It is a decompensated schizophrenia. Now, what do you mean by this decompensated? You should know that. You should know the meaning of that word decompensated. Decompensated. So this is grandfather. Father is not helping, so we are going to grandfather. And father's list, there is no decompensated. Okay. So I went to grandfather, that is Merriam-Webster dictionary. So decompensated. What is the meaning of decompensated? Okay. Decompensation. A very serious condition. Loss of physiological compensation or physiological balance, that is decompensation. Schizophrenia is out of balance, too much, out of balance, imbalanced schizophrenia. There's the seriousness. Earlier she was balancing, okay, somewhat, okay, but now it's decompensated. The balance, maintain adequate balance is gone. Okay, so that's why. Now, who was admitted to the hospital with decompensated schizophrenia? Right. Requires okay, what long-term care home requires what here it is, follow-up. That's what is given. Two pieces of information, so that's a little confusing. So follow-up, management, care, long-term care, ongoing care requires ongoing care and appropriate management, comma, following the discharge to your facility today. Miss Bethany Taylor, who was admitted to the hospital with decompensated schizophrenia, requires ongoing care and appropriate management following the discharge to your facility today. So this is what you can write. Now let us make the 3 sentences here. So, Miss Bethany Taylor, we are splitting the sentences. I want everything here together. Miss Bethany Taylor, right, was admitted to the hospital. We can also say was self-admitted, no problem. To the hospital with decompensated schizophrenia. Okay, this is one sentence. This is sentence number 1. This is why she got admitted. The reason. This is called the reason why she got admitted. Okay. The next one is what is the reason why she got admitted here? What is the reason why she is getting discharged here? Miss, okay, Bethany, sorry, Miss Bethany Taylor. Miss Taylor, not Bethany. Miss Taylor, yeah. Miss Taylor, or you can say she. She requires this active voice. She requires what? Ongoing care and appropriate management at your facility. Okay. She is being discharged today. We need not write to your facility because already here we are. If you write here, it will be at your facility. Any one place you can write this one. At your facility. But if you write here, she is being discharged to your facility today. Any one place you write, don't write 2 places. If it is here, it is at your facility. She requires at your facility. And this is she is being discharged to your place. Any one place you write. Your facility. At your facility you write along with the purpose, or to your facility along with the discharge. Like that you write. So this is the way how you can write. Many people think that they know very well, so that's why they don't attend these points. No problem. We are least bothered about everyone. We are bothered about the regular students who are really serious. So she is being discharged to your facility today. Right. So this long-term care home, already we have mentioned here. There is a long-term care home. Where is this? Here. Proudest mental home, the long-term care home. So ongoing care, long-term care means ongoing care, continuity of care. So you can write like that. So now she requires ongoing care. Now this is what? Active voice. This is active voice. Active voice with the personal pronoun. Active voice with personal pronoun. Now this one we can change into passive voice. Ongoing care and appropriate management are required. Okay. Ongoing care and appropriate management are required by her. That's the meaning. She is being discharged today. The discharge has been scheduled for today. Or you can say the discharge for today has been scheduled. Don't say discharge has been scheduled today. For today. Okay. The discharge today has been scheduled. Yeah. So this is the way how you can write. This is passive voice. Without she, personal pronoun. Without personal pronoun. She is being discharged. This is passive voice only. But there is personal pronoun. Okay. This is also passive voice. But without personal pronoun. So try to understand this. So this is how you are going to write. There are many different styles you can write. There are many different styles you can write. So this is nursing letter. Is the information clear? Just hit the button yes or no. Just hit the button yes or no, please. Now the introduction is done. Now the conclusion. Now the conclusion. Now conclusion is here. We are going to write the conclusion here. Conclusion will be something related to this one. Okay, to be quotes. Okay. Let us take the same thing and put it here. How? Based on this one. Okay. Miss Taylor, who was self-admitted with decompensated schizophrenia, requires follow-up at your facility following the discharge back to the apartment today. Follow-up at your facility, discharge back to the apartment here. So you remember that. Now here, how you can conclude this and this should be related based on the aforementioned circumstances, comma. Having considered the aforementioned circumstances and based on in view of the above mentioned circumstances, any way you can write. Based on the aforementioned circumstances. Okay, change a little bit. So follow. Okay. Follow. So regular action plan and regular action plan, regular, okay, continuity of care, you can say. Continuity of care and appropriate management of the condition would be profoundly beneficial. Full stop. Based on the aforementioned circumstances, continuity of care and appropriate management of the condition would be profoundly beneficial. So that is done. And okay, many people think that this sentence will be the conclusion. No, this coming sentence is not the. They'll write two different sentences, right? In case any additional information is deemed extremely relevant, please do not hesitate to contact me. So many people think that this is the last paragraph, and this is the conclusion. No, these two together is conclusion. In the conclusion, you will revise the introduction and then tell that after all these things, based on the aforementioned circumstances, what you want, continuity of care and appropriate management. That is nothing but follow-up of the condition would be profoundly beneficial. In case any additional, these two sentences must be there in the conclusion. These two sentences must be there in the conclusion. Many people write in the discharge plan based on the book. No, don't write in the main body paragraph 3. Okay, it's very important that you have to write these two sentences here. It's very important. So, a reiteration of the introduction in a different style. That's it. So this is the way how you can write for this. And then regarding the nurses. Now let us take here. Right. Miss Bethany Taylor was. So here, how are we going to write this one here? Yeah. So this requires ongoing care and appropriate management. These two things are there. Okay. Those two things will come forward here. These two things, but we'll have to change this one. We have to change this one. Okay. Now, based on the aforementioned circumstances, ongoing care and appropriate management. We already written. So here, continuation. Okay. Regular supervision, regular observation or supervision, and okay, necessary management, okay, necessary follow-up action plan would be profoundly beneficial. In case any additional information is deemed extremely relevant, please do not hesitate to contact me. That's it. So that's fine. So introduction is finished and conclusion is also finished. Now we are going to learn the paragraphs, sentences. What sentence will go where? Like that we'll see. Sentences. Don't think that this is doctor sentences. Don't think that it is nurses sentences. Okay. We are learning sentences. That's think like that. Okay. So here you can say main body paragraph. Here you can write upon admission. So she was admitted. So upon admission, right? And the main body paragraph. So she was in the hospital during hospitalization. So upon discharge, upon admission, during hospitalization. Okay. Then here, post discharge. Post discharge. So following the discharge. Following the discharge means upon discharge. Upon discharge. I'm just giving you an idea. That's all. So here, discharge letter, you'll write first upon admission. That means at the time of admission, okay, what was her condition? During hospitalization, how improvement is there? Upon discharge, what is required? So this is discharge plan. You'll write the discharge plan here. What is required here? And during the hospitalization, how the condition was managed. Okay, the management, how done, the progress. So progress. So what action, progress. And here, upon admission, the condition. Here the condition, here progress, here discharge plan. Upon discharge plan. That's it. So first one, what was the condition? During hospitalization. So these three things. Yeah. So now it is very clear. So first one is upon admission. Second one is during hospitalization. Third one is upon discharge. This is what is discharge plan. I'm talking about the organization here. So when he was admitted, what was his condition? Everything you have to tell here. Then here during hospitalization, how it was managed. This condition, how it was managed. And after that one, how you have to plan for that. So you are giving the directions. You are giving the directions. These are called plan or direction. You are giving him, right? Based on the doctor's, if it is a nurse, based on the doctor's suggestions. Right. So remember this. This is the condition before admission, on admission. This is the progress during hospitalization. And this is upon discharge, what is required, what is anticipated, what is expected to be done. So this is the purpose will go here. Right. So that is very clear. Right. In the same way here also. Okay. Now let us check the sentences. How the sentences we are going to write here. Upon discharge, what will come? So this you'll begin the paragraph with upon discharge, during hospitalization, upon discharge here, upon admission here, sorry. So this is how things go. Now first in the main body paragraph, what we will write here. Okay. Now, upon admission, how the condition was there. Now let us see here. So this is medical background. Admission, upon admission, medical background. Okay. This is nursing management, means during hospitalization. Okay. And afterwards also. And afterwards also. Right. Then next, how she was managed. Okay. Right. And this is discharge plan. Okay. Right. If you see here very carefully, so this is going to be paragraph 1, body paragraph 1, medical background. Okay, medical background. What are the important things you notice here? Organization, I'm showing you now. Organization, many students came and left. Okay, what to do? So first one is, you can see very clearly here. Okay, less disorganized thinking. Less disorganized thinking. Yeah, less disorganized thinking. This is one important things. This is one important things. And no signs of thought blocking or latency here. Okay, less disorganized thinking. So that means here less disorganized thinking. Then where we have to go, this is not the right point. So now here it is. Responding, okay, agitated and aggressive. You can see here. Agitated and aggressive. This is one point. Okay. And then responding to internal stimuli with thought blocking and latency are there. So responding to internal stimuli with thought blocking and yeah. So these are the points, 2 points which you have to note. This is number 1. Point number 1. And next one is point number 2. Point number 2 is this one. Yeah. Responding to internal stimuli, but with thought blocking and latency. Now we'll make one sentence here. So next one is number 3. Point number 3. Let us take some more points. So here point number 3 is delusions are there. She's having these delusions. This is the 3rd point. Okay, regarding various political leaders, delusions are there. Okay, that is number 3. And anything else is there? Check there. She has visual hallucinations also. So this is another point. So visual hallucinations, shadow figures with grinning faces. So these are the 4 points. Okay, all these were experienced upon admission. These are the experiences. So she is experiencing agitation, aggressiveness, experience. She is responding to internal stimuli. She had thought blocking. She has latency. Then delusion. She is experiencing delusions, and she is experiencing visual hallucinations. Yeah. So these are the points which you have to discuss. So now let us think about these 4 things. So upon admission paragraph, remember that. So this is the condition upon admission. Okay, I want to ask you one question. Are you with me? I know nobody will respond, no problem, but still I want to ask. Are you with me? Are you able to understand everything which I am explaining you? We are learning sentences. Asha Jama, thank you. Pranita, thank you. Noor, thank you. So the others don't want to comment. Okay, leave it. We cannot expect everything from everyone, right? So we'll not mind too much what to do. So, good qualities. Okay. Somebody is asking. You have to respond, that is better. So now let us see here. How we are going to write? So you start with upon admission, comma, upon admission, comma. So who was expecting Miss Taylor? Miss Taylor, sorry, Miss Taylor was experiencing. Why was experiencing? Because it was admission time. Now it is discharge time. So past tense, was experiencing what? Was experiencing. All these things are there, right? Admitted for auditory command hallucinations, telling patient to harm herself. Telling patient to harm herself. Yeah. So self-harm. Self-harm. Try to understand this. Self-harm. Auditory command hallucinations. Hallucinations. Here. Auditory hallucinations and visual hallucinations. That means both audio and video. Visual hallucinations are there and auditory hallucinations are also there. So both all together, all type of hallucinations, audio and visual hallucinations, both are there, audio and visual. See how I am taking the sentences from where and where. Auditory, command hallucinations and visual hallucinations. Both types of hallucinations are there. So you have to understand this one. And so this is a disorder. This is a disorder. So mental disorder. Mental disorder. So mental is related to thinking. She's thinking, okay, all these things. Right. Internal stimuli. Thought blocking. So thought. Related to thoughts, thinking style. Disorders related to thinking. You can understand. Thought blocking and latency. Thought blocking. She is not able to think properly. Thought blocking. This is thought disorder. Okay, thought blocking and latency. Now, what is this latency? What is this latency? The fact of being present but needing particular conditions to become active, obvious or completely developed. Latency. Latency is formal word. Latency is formal word. Remember, formal means official letters you can write. Latency. Okay. That means in underdeveloped or developing, not completely developed, latent. You see in biology in your schools, latent. Latency means undeveloped. Okay. The latency period for the cancer is 15 years. After that, it will be dangerous. That's it. So latency means growing stage. Right. So thought is the problem here. Thought. So thought disorders. These are blocking is a disorder. Thought blocking. Thought thinking style is not developed well. Okay, thought blocking. So you can write like this one. So Miss Taylor was experiencing considerable or significant thought disorder. Once again, you see agitated and aggressive, responding to internal stimuli with thought blocking and latency. So here it is, thought blocking. This is the main problem. This is the danger zone, thought blocking. Thought blocking and latency. So thought disorder. significant thought disorder, which includes okay, which includes blocking and latency. Which includes thought blocking and latency. That is the sentence we have used. Okay, right. So what else you can say here is, now she was also, or additionally, we can say additionally, comma, she was experiencing, she was exhibiting what she was exhibiting, delusions and hallucinations. Delusions and she was exhibiting delusions and visual as well as auditory. So which one is first here? Okay. Which one is first here? Auditory command hallucinations and visual hallucinations. This is also there. Copy text. We missed copying here. That also will come here. Auditory command hallucinations. Okay. Auditory command hallucinations and visual hallucinations as well as. So here first is auditory. Audio and visual. Audio will come first. Auditory as well as visual hallucinations. So, upon admission, Miss Taylor was experiencing significant thought disorder, which includes blocking and latency. Blocking and latency. Right. The next one. Additionally, she was exhibiting delusions and auditory hallucinations. Okay, these are the two sentences we are taking. So, sentence number one. Sentence number one. And this is sentence number two. This is sentence number one. And this is sentence number two. Okay. Sentence number one and sentence number two. Remember. Because why I'm putting it here. Okay. So sentence number one and sentence number two. We'll improve it afterwards. We don't need Miss Taylor because we already talked in the previous sentence. How many times do we want to speak? It is understood that only one Miss Taylor is there, the patient. And she is also not required. So, right. More than patient. Patient is already important. You know, the condition. So, significant thought disorder is important. So, we'll make this the hero of the sentence. We'll make this the hero of the sentence. We'll make delusions and auditory as this as the hero of the sentence. This particular sentence. She is not the hero here. She is not the hero. Miss Taylor is not the hero. Hero is always the hero. But here, newly introduced is thought. It is in this sentence. Miss Taylor is introduced long back. So why do you want to make it still a hero? It's already the total hero. It's the absolute hero. In the beginning only, see, regarding Miss Bethany Taylor, perfect hero for the entire letter. Then why do you want to degrade it and make hero of every sentence? Is very low quality. So that we'll see later, second round. Okay. And third sentence is regarding what? Let us see. So two sentences are there in this one. These things have come into two sentences. Then agitation and aggressiveness. Okay. 3. She was agitated and aggressive. This is third sentence. She was agitated and aggressive. This is the third sentence. Okay, this is the third sentence. So these are the three sentences. Now, how will we improve these three sentences? Okay, now let us see. I'll copy these things on. These three sentences I have copied here and I'm modifying. And I'm making it super sentences now. Okay. I'm modifying these sentences to powerful sentence. Upon admission, we don't need a Miss Taylor. This is correct only. I told you this is correct. This is correct. File. This is correct. This is correct. No doubt regarding that. All are passive sentences only. But nouns and pronouns are there. So weak. Correct only. But weak form. Weak forms of passive voice. Passive voice only. All are passive forms only. But they are weak forms because every time, every sentence there is Miss Taylor. Every sentence you are writing one sentence Miss Taylor, another sentence she, another sentence she. What is this Miss Taylor doing in every sentence? Miss Taylor is the supreme hero. And why are you bringing the prime minister and making him a chief minister of every state and every city and every town and every village? It's like President of America starts ruling every, becomes mayor for everything. Then where he will, what is the importance of the President of America? If the Prime Minister of India starts ruling every state, then what is, how much degraded the qualities, power is there? So we are decentralizing. We are decentralizing and giving the rule to a lower. In this sentence, newly, so she is not important. Miss Taylor is not important because already it is present like water under the mat. It's already there. She. Why so many times is she? Passive voice, weak forms. Why? Because of personal pronouns. Many people will not have the time and patience to learn all these things. Okay? So we are not bothered about them here. So passive voice only, but weak forms because there are personal pronouns. Now you know Mr. Taylor is the Prime Minister of this letter, of this country. It's there here regarding, everything is regarding Miss Bethany Taylor, the superhero, the superhero. And why are you degrading the superhero to be a normal hero? Okay. The main hero will not go everywhere. He will send his assistants. Okay, now coming to the point. You eliminate this one, Miss Taylor. Eliminate. So here, we are eliminating this one. Let me show the review. Miss Taylor. I'm eliminating Miss Taylor. No need. We know that only one Miss Taylor is there. She, no need. She, no need. Now, what we are going to do, see here. We'll start with which is the newly introduced here, significant thought disorder. This is the hero of this particular sentence. So we are starting the sentence from here. This was experienced will go from here to here. Okay. Now let us see. This was experiencing went from here. Significant thought disorder, which includes blocking and latency, were experienced. I don't know. Many people were asking me personally, and I really appreciate these students. Okay, bless Jose. Relax. Okay. Yeah. There is one student. I don't know whether they are there or not. Most of them are on duties, I think. But let me tell you, I'm proud of some students. These students have asked me. Okay. Yeah. The first one to request was Meera Manoj. Hello, Meera Manoj. Can you unmute? If you cannot unmute, it's okay. No problem. I think you are on the computer. Okay. She was asking me to explain the sentences. And she was very actively participating in writing vocabulary. Yeah. And then next one is Noor Alam. Hello, Noor Alam.
Hello, sir. Good evening.
Good evening. Are you on duty or?
Sir, duty is almost finished.
Yeah. Okay. Fine. Just one
but
second.
I was mostly joining. No problem.
Yeah. I'm sorry for that. I'm sorry for that.
No, sir. Okay.
See, you were asking me, sir, explain sentences how to write. Correct?
Yes, sir.
So I am giving you these explanations. Do you understand why this is quality and why this is not a quality? Is my explanation clear to you, Mr.
Hello?
Yeah, is my explanation clear to you?
Yes, sir. It is clear. It is very clear.
Okay. So now why you should not use active voice? Why should you not use personal pronouns? You are able to understand. Correct?
Yes, sir.
Okay, that is what I wanted to ask you. Yeah. And there is one Bless Jose. Hello, Bless Jose. Hello, Bless Jose.
Hello, sir.
Yeah.
Good evening.
This is what you told me, sir. You are writing corrections as amazing, marvelous. What all you told, I don't remember. But do you understand how to make it marvelous? Now you understand.
Yes, sir. I said that you write very effectively. Yes.
Yeah. So are you able to understand how to write effectively now?
Yes, sir. Completely.
So every sentence has a hero.
Yes.
And the letter has a superhero. The superhero is Miss Taylor. So that's why no need to tell Miss Taylor everywhere. So degrading the superhero to the level of hero is nonsense. People who don't know the quality, they write like that. We don't want that quality because you are special students. You can learn. So that's why. So learn that one. Next, Marinang Makoko. Marinang Makoko. Yeah, are you able to understand why we should not use Miss Taylor everywhere?
Yes, I'm trying to follow, and I hope I'll use the same format that you have just taught us.
If you are a senior nurse, if you are a charge nurse, will you go and do the duty of every nurse?
No, sir, I'll just delegate them.
So that is called distribution of power. These words are linguistic terms, not everyone can understand. Distribution of powers, we call it distribution of powers. So
okay,
we are giving different powers to different people. So everyone will, the rule will be perfect. Correct or not?
Correct, sir.
So we are separating the powers and we are giving the importance there. Okay, Mira, you are on duty, no problem. Yeah. Now let us see here. Here, significant thought disorder is the hero of this particular sentence. So we'll start from this one. Significant thought disorder, which includes blocking and latency, comma, was experienced. It's not were experienced, it was experienced. I'm sorry. Significant thought disorder was experienced. And this disorder includes blocking. So here there are no two things. There is only one thing. Significant thought disorder was experienced actually. But in between, okay, we added which includes blocking and latency. So significant thought disorder. So these are in brackets now. So that is what you have to understand. So subject is a significant thought disorder, and this thought disorder related to blocking and latency. So we are not saying blocking and latency were experienced. Try to understand here. We are not talking about blocking and latency. Blocking and latency are only examples. So this experience is related to not blocking and latency, but the experience is related to thought disorder. Significant thought disorder was experienced. For example, let us see here. Now, this, forget this one now. Forget this one now. Significant thought disorder was experienced in relation to, for example, you can say. So now here was experienced, for example, you can add like that. So we don't need that. So let it be as it is. We know how to write quality. So significant thought disorder was experienced. That's it. Now in the same way here, she was exhibiting. She was exhibiting. We don't want. So we'll start with the delusions and auditory as well as visual hallucinations. And this was exhibiting will go here. Okay, we'll go here. So significant, additionally, delusions and hallucinations, here there are more than one, were exhibited. She was exhibiting, but they were exhibited. So simple as that one. Additionally, delusions and auditory as well as visual hallucinations were exhibited. Past tense, because on admission is past tense. If it is now means have been or has been will come present tense. She was agitated and aggressive. So this one was will come to the last. And there are two things. Agitated will become agitation. And aggressiveness were reported. Finished. She self-admitted. That means she was able to tell it. So she reported. Finished. Were reported or were informed. Okay. Or were noticed. Finished. This is the way how you have to write. Where is Miss Taylor here? Where is she? Don't you know that this is a continuation? Huh? Don't you know that this is the continuation? So this is the way how you have to write. This is the way how you have to write. So I have given you two different styles. One is with the subject called Miss Taylor with the superhero, and second one is the normal hero. This, why are you degrading this quality and making it unimportant? You should make it the subject of the sentence. You are talking about, especially here, about in this sentence, the hero is significant thought disorder. Why are you degrading its quality? And why are you degrading Miss Taylor's name and using it everywhere? Superhero is becoming hero, and hero is becoming a useless fellow here. Importance should be given to the thing which is more needed. Newly introduced one is the hero of the sentence. Every sentence you talk something new, that should become the subject. Here also subject is there. Here also subject is there. This subject is significant thought, but here the subject is Miss Taylor. Why every time? That means every time you are not talking about Miss Taylor, but already it is understood, so no need to tell about that. So the concept is clear. Concept is clear. Now it is your wish how you want to write. It's up to you. Okay. And you can write in, okay. Actually here, Miss Taylor was experiencing. This is active voice. This sentence is active voice here. Miss Taylor was experiencing. This is not passive voice. This is active voice. Okay. So active voice also is there. She was exhibiting. This is passive voice. Okay, this is active voice. She was experiencing active voice. Okay. And you are bringing the noun there. Okay. More important thing is here, this one. When you are introducing a new topic, start with the new thing. Don't bring the old thing again and again, making a nonsense out of sense. Okay. So this is passive voice with personal. These both are passive voice with weak form personal pronouns. This is a passive voice. This is passive voice. But here, all are passive voice, and there is no, okay, which is more newly important thing. Okay. These are passive voice sentences. Passive voice sentences. And in every sentence, newly introduced subject. Newly introduced subject. Not the previously introduced subject. This is the highlight. This is the highlight of this type of sentence. This is the highlight of this type of sentence. Every sentence, newly introduced subject is there. In this significant thought disorder is the subject. In this delusion and hallucinations are the subject. And in this agitation and aggressiveness are the subjects. So subject should be newly introduced every time. Otherwise, it will be nonsense. I went to the market, I bought some vegetables, I paid the amount, I loaded into the car, and I came back. It's nonsense. It's nonsense. Okay. So avoid such things as far as possible. So right. So next we'll go to the, shall we move to the next? Shall we move on to the next paragraph? Shall we move on to the next paragraph? Okay. Right. We are going to the second paragraph during hospitalization. During hospitalization. During hospitalization. Next one. Okay. Now let us see during hospitalization. This is finished. During hospitalization. So now here. So during so this till here it is gone. Then this is all nursing management only. So after this is admitted here. Okay. After admission, what happened? Commenced done, and this commenced means continuation. Okay. Condition here. This is the next one. So this admission finished. After admission, that means this is all during hospitalization. So commenced on antipsychotic medications, risperidone. Antipsychotic medications, risperidone. Risperidone, no, risperidone, spelling wrong, spelling mistake. Risperidone. This is spelling mistake. You can see here, this is the correct spelling. Risperidone. Risperidone. This is the name. So the spelling is mistake. This spelling is correct. But what about this spelling? Is it there? Only one type of spelling may be right, not both. So copy text and we'll check here now. Yeah. There is nothing called risperidone. It is risperidone only. So risperidone. So this is the correct spelling. So we'll correct this one. Yeah. Risperidone. Okay, fine. So we have corrected that. That's okay. So risperidone commenced antipsychotic medications. Number one. Okay. Number one commenced. Right. Next one. Patient ceased reporting auditory or visual, less disorganized thinking, no sense of thought blocking or latency, able to minimize delusions. Okay. Now, so commenced antipsychotic medications. So why? Why? Because she was not compliant. She was not compliant with medications. She was not compliant with medications. Remember that one. So that's why that is commenced on antipsychotic medications. Okay. So these medications, because she is not compliant, already she is taking this medications. So she was recommenced. That's it. So she did not take, so again started. So started again here actually. She was taking these medications for schizophrenia and now she stopped not taking properly. So commenced now. Commenced now, but it already commenced. So now it is recommenced. Okay, she was recommenced, right? So now here you can write that one. What is that? Commenced antipsychotic medications. Copy text. That is first point. Okay, that is the first point. Commenced antipsychotic medications. Number one. Okay. Then because this medication was given, okay, because this medication was given, then what happened? Earlier non-compliant, that's why this decompensated schizophrenia. Now compliant. Earlier non-compliant, so decompensated schizophrenia. Now started medication, so now becoming compliant. Earlier not compliant, so that's why decompensated schizophrenia. Now this decompensated condition is deteriorating and now it is becoming better. So the condition is becoming better, right? So patient ceased reporting auditory and visual hallucinations, less disorganized thinking. Earlier it was too much. Now no signs of thought blocking. So condition is increased, better, becoming better now. Condition has stabilized. Condition has stabilized. So stabilized condition. So condition stabilized. Condition stabilized. Condition stabilized. This is not physical condition, this is mental condition. Okay, mental condition. You should know that because this is schizophrenia. Mental condition. Mental condition stabilized now. Okay, mental condition stabilized. Next, if you see very clearly here, now activities of daily living, able to minimize, able to. Now her condition is ability is there. Earlier she was unable, now she is able to do. So she is able to perform activities of, she is able to minimize and focus on, she is able to focus on activities of daily living. She is able to focus on activities of daily living. So next one is can, able to means can. Many people say can be able, I can able to. It's wrong. Say can or able to. Anyone remove able to and put can, or can remove can and put able to. Can focus on activities of daily living. This is the third point. Can focus on activities of daily living. Now, next one. Next one. Focus on activities of daily living, and then objective signs of psychosis, delusion, ensure medication compliance. Okay. And assessment. Yeah, this is assessment during the hospitalization. Can decompensate, condition may worsen if abusing substances, not on medications or abusing substances. So abuse, drug abuse. Okay, medication non-compliance and abusing drugs. Okay, insight is good and judgment fair. So now the condition is very much improved. Condition is very much improved. Insight is good and condition is fair. Insight is good, or you can say good insight and fair judgment. Good insight and fair judgment. Yeah. Good insight and fair judgment. Then what else is there you see here? Good insight and fair judgment. That's very fine. And the nursing management, you see, so what was managed? Nursing management, what did they manage here? Okay, compliance, medication compliance. So that's why, because of this medication compliance only, this condition improved. This condition improved, okay, because of this nursing management. Nursing management involved medication compliance, not medical compliance, medication compliance. Now what to do? Ensure medication compliance. Ensure medication compliance. Medication compliance. Right. Ensure medication compliance. So this was ensured in the nursing management. Now also we did, you also do the same thing. Ensure medication compliance. Yeah. Medication. Medication compliance. Fine. Medication with what? Antipsychotic medication. This one only. So that is what was done. Huh? That was done. So either here you write or here you write. Medication compliance here or here. It's okay. Medication managed with it. Okay. Right. The next one. Medication compliance. Then in addition to that one, so behavioral control and therapy were given. Behavioral control and therapy were provided, have been provided. Behavior control and therapy have been provided. It's okay. Behavior control and therapy. Behavior control and therapy. Behavior control and therapy. Okay. And after all these things, okay, after all these things, what happened? No signs of thoughting, no signs of thought blocking. Okay, no signs of thought blocking. Then minimized delusions. Then can deconstruct abusing something inside good judgment fair. Yeah. Able to minimize delusions. Sorry. Able to minimize delusions. So, no signs of thought blocking, no signs of latency now. So, after all these things, no signs of thought blocking and no signs of latency. Okay. And no less disorganized thinking. Okay. So, 10/3/2018, Patient ceased reporting auditory or visual hallucinations. This is totally stopped. Okay, totally stopped. Right. Patient ceased reporting. That means stopped. There are no auditory hallucinations, no visual hallucinations. So, cessation of ceased. Ceased means a cessation, noun, changing. Cessation of auditory and visual hallucinations. Visual and auditory hallucinations. So they ceased. So ceased becomes cessation here. Okay. So ceased means stopped. So these are the points which you can write. Anything else is there? All are included. Assess for object. This is future. Let's disorganize thinking. That's what it is already we have discussed. So all the points have come. See, every point is clear. So these are the 7 points which you have to write. These are the 7 points which you have to write. Okay. Visual and art. So now these are the sentences which you are going to write. Now, how are we going to make the sentences using these points? Okay. Can you try? Can you try now, or do you want me to explain? A is can you try? Okay. B. Shall I explain? Now you give me A or B first. Azubika says, I will try. Very good. Wonderful. Oh, lovely. Lovely. Yeah, you try, then I will explain. That will be better. Nah? Yeah. I'm giving you, say, 3, 4, 5 minutes maximum. Write down. Write down the paragraph. So these are the points. Yeah. These are the points. You can write 3 sentences or 4 sentences or 7 sentences, your wish. You can relate first 2, the second 2, and 5th and 6th one, and last one separately. So 4 sentences you can write, or 3 sentences you can write, or you can write in 2 sentences also, but don't write in 1 sentence. Better to write 4 sentences. First 2 as 1, second 2 as 1, third 2 as 1, and last one separate. First write down in your notebook and then make it a paragraph. Yes, you can write down and you can type. Write down the main body paragraph 2. Yes, very good. Zubike Elizabeth, Bless Jos, Maranang Makoko. Good. Others also can submit. Very good, excellent. You're trying to do, you can compare now when I tell you. Last 30 seconds. Yes, two more students have written. Very good. Meera Manoj, Ranita, Tata. Good. Yeah. Now let us answer this. Let us answer this. So main body paragraph 2. Yeah. So during hospitalization, comma, right. During hospitalization, comma, one more student has written. Very good, Aisha Jama, very good. During hospitalization, okay. Antipsychotic. Aisha Jama has sent a message to me. What is that? My first This was my first ever sentence I wrote in OET. Wow. Wonderful. Wonderful. During hospitalization, antipsychotic medications were commenced. That first sentence was 100% correct. Following that, good insight and fair judgment were noticed. Correct. Full stop should be immediately. No place before full stop. After full stop only. Yeah. As well as visual and hallucination words. As well as is not fine here. Visual as well as auditory hallucinations. Okay. Were seized. So as well as it doesn't suit. After visual, you have to use as well as, or not only but also. Otherwise, everything is correct. Everything is correct. Okay. So I'm sorry, I cannot correct everyone's because she sent a message. So first letter, first sentence, so I corrected. Right. Antipsychotic medications have been recommenced. Okay. And consequently, the mental condition was stabilized. Has been stabilized. This is present tense. During hospitalization means now also she is hospitalized. She is being discharged after some time. But now she is hospitalized. So his present mental condition has been stabilized. Okay. Has been stabilized. Okay. Performing activities of daily living has been possible full stop. Performing activities of daily living has been possible. Right. Nasra Muhammad. Very good. So, insight, good, and judgment, fair. Good insight and fair judgment, good progress. So they were noticed. Okay. Good insight and fair judgment have been observed or noticed. Okay. Then medication compliance. Medication compliance. So medication, ensure medication. We have ensured, you also ensure. That's it. Right. Medication compliance has been ensured, established or ensured. Okay. Or you can say focus on medication compliance, focus on medication compliance, comma, focus on medication compliance, comma, behavioral control, and therapy providing therapy, compliant, ensuring medication compliance, ensuring medication compliance, controlling behavior. See how I am modifying. Controlling behavioral patterns and providing therapy. Ensuring medication compliance, controlling behavioral patterns, and providing regular therapy. Okay. We'll make a listing of this one. Okay. We'll make a listing, we'll make a better sentence. Medication compliance has been ensured, semicolon. Behavioral patterns have been controlled and regular therapy has been provided. Full stop. So this is called a listing of things. This is first sentence, this is second sentence, third sentence joined with semicolons. Joined with semicolons. Yeah. Next one. Cessation of visual cessation. Cessation, ending or stopping. Okay. Cessation of visual and visual and auditory hallucinations. Cessation has been, sorry, she reported. Patient ceased reporting, stopped reporting. because she stopped reporting about them. Okay. Has been observed. Cessation of visual and auditory hallucinations has been observed. Cessation has been off. Off is not the point. If you remove this one, cessation has been observed. Has been is the verb. Observed is the verb. Cessation observed. Okay, we observed cessation. That's it. Cessation related to this one. This is an extra addition in between. So if you remove that one, cessation has been observed. That is called subject verb agreement. Subject verb agreement. Subject is the beginning, and after everything is finished, so this is called noun phrase. Then afterwards, verb is there, has been observed, like that. So during hospitalization, antipsychotic medications have been recommenced, and consequently, the medical condition has been stabilized. Performing activities of daily living has been possible. Good insight and fair judgment have been noticed. Medication compliance has been ensured. Behavioral patterns have been controlled, and regular therapy has been provided. So these are listed. The first one, second one, third one. 3 in 1 sentence. There are 3 different sentences. Medication compliance has been ensured, 1 sentence. Behavioral patterns have been controlled, another sentence. And if you remove one, regular therapy has been provided, 3rd sentence. 3 sentences joined into 1 sentence using listing. What do you mean by listing? Listing, listing, listing. Okay. The official listing of things. So, listing of things. Listing of things. List. Yeah. So this is, read this one afterwards, how to make lists. Different lists will be there. So like this one. Listing things with the semicolon. Instead of commas, he takes metformin 100 mg with his evening meal, lisinopril 10 mg and atorvastatin 20 mg both once. So this is called, this is with commas. You are removing the commas and you put semicolons. So swap commas for semicolon. Remove the commas and put semicolons. That's all. Okay. Put semicolons. Then it will be easy for you. See, he takes metformin and 1000 mg with his evening meal, semicolon. Because here there is one comma and here there is one comma. Too many commas are there. So this is metformin related information. This is lisinopril and atorvastatin related information. Both together. So like that. So put a comma there instead of. So these are 2 different things. One is metformin in the evening. and this is lisinopril and atorvastatin. This is different thing. So separated together. Otherwise, it becomes a mess like that. So now we have made a list like that. So instead of comma, we put semicolon. Okay. Last one and is there. That's what. So now here you can see very clearly. There is no he, there is no she, there is no it, there is nothing. Okay. This is called quality. Quality, quintessential quality. Quintessential quality. Now, what is quintessence? Quintessence is formal. The most typical example. Quintessential quality means most typical example for quality. So, this is the way how you can write the sentence. So, shall we move to the next paragraph, or shall we call it a day? I am also tired, but still, your word is final. If more than 50% says continue, I'll continue. Otherwise, we'll consolidate these things and tomorrow we can continue the remaining part. Your wish. Next question. Continue or stop? A. Continue. Stop. It will go above your head. Your wish. I have no problem. Yeah, all of you respond. All of you respond. Yeah. Bless Jose, Azubike Elizabeth, and Maranang. 3 people said continue. Meera Manoj, Ranita, and Asha said will continue tomorrow. Stop. So I am adding to this one now. There's a veto power. That is, we're going to continue afterward. This is mine, B. Because it will hammer your brain. It's not ordinary thing. Huh? Heavy meal, if you eat, no, you cannot digest it. Okay. You cannot digest. 1 second. Just give me your feedback and go. What did you learn? Whoever wants to say good night, no problem. Yeah, I'm unmuting everyone. Yeah. So first, let us start with new student Pranita Tata Birla.
Hi, sir. Good evening, sir.
What is this Tata? Where did this Tata come from, Pranita?
This is my father initials, sir.
Okay. Yeah.
After marriage,
Share your experience. How was the session?
Okay, sir. Today I'm learning so many things, sir. I don't know how to formation of sentences. It is very, very useful for me. I want to learn like this type of sentences, sir. I don't know how to correct, but I don't know, sir. But I am learning day by day, little. Thank you so much, sir. Actually, these are free classes for me, no? But I am learning little, sir. Thank you so much. These are very useful for me, sir.
Yeah, you already registered for the course in advance. No need to worry. Okay.
Okay, sir. Okay, sir.
Already
Thank you.
registered for the course in advance. You paid the amount in advance. Okay.
Okay. But I
Requested
am
you
very
want
poor
to
in
attend
sentence
some
formation
sessions.
and grammar, sir. So that's what I am worrying. So much worrying. But I'm having a little bit confidence. nowadays.
Very good, very good. Okay, Maranang Makoko.
Yes, sir.
Yes, Maranang. I think if you have a revolver in your hand, you'll shoot 6 shots straight into my forehead, right?
No, sir. I'm just cooperating with the passive voice, but it's a bit challenging, but I'm following daily on how to formulate the sentences using the passive voice.
Okay, little by little improving, na?
Yes, sir, and indeed I'm cooperating. Thank you, sir.
Yeah, very good. Next, Aisha Jama.
Hello everyone. Yes, I'm very happy to attend this class today about forming the sentences. This is my first sentence, as I told you, sir, that I'm writing today. So hopefully next I will start to write my I will start to write the OET letter. So really, I'm so excited, and thank you so much. I got a lot of information. I have to
Very
focus
good.
on how to make the sentences like passive voice and all. Thank you so much.
Right. Yeah, Meera Manoj.
Hello, sir.
Yeah. Share your experience.
I'm also improving to write a passive voice and a sentence construction. Then thank you. Good night, sir.
Yeah. Next, Nasra Muhammad.
Yes, sir.
Yes,
Yes,
Nasra.
sir. Yeah, today I am on duty. I was 50% with you and 50% at the work, so I wasn't 100% with you, sir. I'm sorry for that, but it was my evening duty, so I could not be fully with you. But really, these kind of lectures we need, and we are doing hard work with us since you are every day focusing different module and empowering us and giving us the knowledge we need in each module in OET. Really, we are getting benefit, and it's improvement, daily improvement that will eventually lead us to succeed in OET. Thank you, sir.
Yeah. Next, Bless Jose.
Hello, sir. Good evening. Actually,
Yeah, good evening.
Sir, I came a little bit late from the shift. So till the part, then after I joined, I learned the way you how formulate the sentences. I don't know when I learn in this way, but this is really academic level for me. I think yes, it is. But I really need to learn punctuations also from you, sir. So that would be more helpful to formulate the sentences effectively.
Right. Very good. Very
Rest
good.
of class.
Yeah. Continue.
So rest the class was really good. I mean, I missed the half an hour, like before it has been started, so missed the session. I was on
No,
the
you can
road
watch
at
it on the YouTube, no problem.
Yes. So like live is totally different than YouTube.
Yeah, of course.
Yes.
Right.
So rest punctuations also, then that would be all. It'll really a punch for the sentence to write it in a better way.
Sure.
So,
Noor
thank you for
Alam.
your good night.
Yeah, welcome. Noor Alam. Mr. Noor. Noor is busy, I think. So, fine. Hello, Noor. Okay. So, that's the end of the session. We have completed the session. And I know you are busy, I can understand. So, that's fine. We'll meet tomorrow. Have a nice day. Bye-bye. So I'll say file save as PDF. Yeah, good night. I will send you this one. This is the first part.